Good morning, ladies and gentlemen. This is Aisha Shehi from the National Health Insurance Company Daman, and I am part of the disease management team. Thank you for joining us today in our Diabetes Awareness webinar. The 14th of November is Diabetes Awareness Day, and this year marks more than 100 years since the discovery of a treatment that saved thousands of lives, which is insulin. On a side note, please note that you can send your questions through the Q&A chat box anytime during the presentation, and we will allocate 15 minutes at the end to answer these questions. Without further ado, please allow me to introduce our speaker for the day, Dr. Ahmed Shihab, Internal Medicine Consultant, Endocrinology and Diabetes Specialist, and SEHA Ambulatory Healthcare Services. Dr. Ahmed, welcome. The floor is yours.
Thank you, Aisha, for a kind introduction. It is my pleasure to be here to talk about the diabetes on this occasion of World Diabetic Day, which in fact reflect how much the diabetes is important to have a special day. And hopefully we'll use this day to talk about it, to increase the awareness of about the diabetes. Thank you. And join here. So today is as I mentioned, is the World Diabetic Day, and let us, we'll go step by step. We need to know to define the diabetes. Diabetes, in fact, is one of the major medical problems, one of the chronic medical diseases which have a lot of impacts and complications in the future for the patient. It is a lifelong condition that requires continuous self-management. Usually diabetes is characterized by high blood glucose. This is, we can say it is a simple definition. In fact, it is not only a matter of blood glucose, it is, we can say that it is, before we say that diabetes, it is a risk factor for cardiovascular disease, but in fact, diabetes, it is equal to cardiovascular disease itself. So it is not only the matter of just high blood glucose. In fact, is related to issue in the producing the insulin. Insulin is the hormone that regulates the blood sugar. If not controlled, then over the time lead to a serious damage to many of the body system. So diabetes is one of the fastest growing health challenges in the 21st century. The number of adults living with the diabetes has been tripled in the last 20 years, and there are more than 537 million adults are currently living with the diabetes. 1 out of 10, which is a really scary number to have diabetes. Let us to see the diabetes, the prevalence all over the world. See our region, MENA region, and Middle East and North Africa. 2019, the prevalence was 12.2 and expected to be an increase in the next 20 years, almost to 14%. The other part of the world also, they are unlucky to have high prevalence. See, the North America is the same, 13%, South and Central America almost 10%, and Western Pacific, South Asia is the same. But which attract my attention that the prevalence of diabetes in Africa, it is less than the other part of the world, just 4.7. I think it's one of the important parts and one important thing to have to consider it in the research in the future, why they have low prevalence in comparison with other parts of the world, which might be due to genetics or the way of living there. In United Arab Emirates, estimated that 11% of the population in the UAE suffers from the diabetes, and an estimated 32% of adult population in the age group from 20 to 78 in the UAE, including both UAE nationals and expatriates, may have diabetes or pre-diabetes over the next decade if a present trend continues. So just imagine 32, that's mean 1/3 of our population have diabetes from the manpower, I mean, in this age group. So it's really, again, it is a scary number to have to think about it. So let us ask ourselves why diabetes on increasing. Definitely, there is a lot of factors behind. One of them is the genetic factor, and it's difficult to modify it, but see the other factors like environmental factor, demographic, socio-economic. This is the parts or the factor I hope to work on it in the future to reduce the prevalence of diabetes. Continued rise is largely due to an increase in type 2 diabetes and related risk factors, which include rising level of obesity, unhealthy diet, widespread physical inactivity. Let's to stop on this three facts. I think we are living here in obesogenic environment. You know, we have high rate of obesity, as we mentioned before, 32%. Maybe they have the risk of, the prevalence of obesity also, it is high in our country. Unhealthy diets, unfortunately, and the diets, fast food is available 24 hours, which is also, and it is an increased risk. And widespread physical inactivity. We'll talk also about this. Just imagine that we are using a lot of time in the office. Most of us are working 8 to 8 hours, and then they have no time for physical activity. This is also an increase in risk, unfortunately. How to diagnose the diabetes? So let us talk about the symptoms. Symptoms patients sometimes present to us with, they call it osmotic symptoms: frequent urination, excessive thirst, increased hunger, weight loss, tiredness, lack of interest and concentration, vomiting and stomach pain, numbness in the hand and or feet, blurred vision, frequent infections, slow healing wounds. In fact, now we are seeing a patient in our practice. They present to the clinic and they have just laboratory workup and show that they are diabetic, they are asymptomatic. And luckily, I think it's likely to catch the patient on this stage of their disease. These symptoms now rare to find it, but can be presented in type 1 or late onset diabetes also, which have autoimmune background. So they can present with the osmotic symptoms. Or sometimes the patient can present with the complication of diabetes, like I mentioned here, numbness in the hand and feet. Patient can present with the complications like diabetic neuropathy, or they came with renal disease, and then we discover they have diabetes. Or as we were before working in the hospitals, patient they admitted to the emergency with stroke or heart attack, and then we discover they have diabetes. So let us talk about the numbers. So the normal range for diabetes, for the blood sugar, patient, or say normal range, if you have the hemoglobin A1C less than 5.7 and the fasting less than 100 and the postprandial less than 140. This is the normal range. We have what they call the pre-diabetes stage, hopefully to work more on this stage to reduce the risk of incidence of diabetes in the future. The pre-diabetes, if you have the hemoglobin A1C from 5.7 to 6.4, or the blood sugar from 100 to 126, and the postprandial or from 140 to 200. So this is the stage of a pre-diabetes. And the patient develop diabetes, they need hemoglobin A1C 6.5 and fasting 126. And we need not to diagnose on just one reading. We have to repeat the test, especially for the fasting. It should be at least 2 readings on 2 to 3 weeks apart. And if the patient presented with 200 milligram blood sugar with osmotic symptoms, enough to diagnose as diabetes. What are the types of diabetes? So we have 3 types: type 1 and type 2 and gestational diabetes. In fact, there is another type, they call it MODY, mature onset diabetes, with strong family history, is not mentioned in this slide. So let us talk about the type 1. Type 1 is caused by an autoimmune reaction between antibodies, immune system, and the beta cells, the cells which are producing the insulin from the pancreas. So as a result, the body cannot produce insulin. So this type of diabetes, patient cannot survive without insulin. And neither the cause of the type 1 diabetes nor the means to prevent it are known. Hopefully, maybe in the future, maybe we'll have with this development in the technology, maybe I hope just to find some marker to predict the one will develop type 1 diabetes. But currently we don't have any, unfortunately, we don't have any screening for type 1 and patient to present to the clinic or to the emergency with full-blown picture of type 1 diabetes. Usually starts suddenly and mainly occurs in the children and young people. So who is at risk for type 1 diabetes? As I mentioned, there is no effective and safe intervention currently exists to prevent type 1. But definitely, if we follow good lifestyle, here there is some evidence that a high growth rate in children is possible risk factor, indicating that the healthy lifestyle again is important to preventing the overeating and sedentarism is recommended. So also healthy lifestyle, in fact, it might help also to reduce the incidence of type 1 diabetes. Type 2, which is the most common one, and occurs when the body doesn't produce enough insulin or doesn't use the insulin effectively. Actually, it is not producing enough insulin, and from the other side, there is insulin resistance, so it leads to type 2 diabetes. It mainly occurs as a result of excess body weight and physical inactivity. As we mentioned before, this is the most, we can say the unhealthy lifestyle. Symptoms are often less marked than type 1, as we mentioned. So type 1 can present with osmotic symptoms. Type 2, they can present only after screening without any symptoms, or can present with complications sometime to the clinic or to the emergency department. So the disease may be diagnosed several years after the onset, after complications have already developed. It started recently to appear in children and in young people, in addition to the older people. Actually, before in our practice, can say it like 20 years before, it's very hard to find type 2 diabetes in children. Any patient came with diabetes in age less than 16, we were expecting type 1, and we work on this fact. But now we are seeing type 2 even in this age, like 10, 12 years. So who is at risk for type 2 diabetes? As we mentioned, there is some factors. One of them is the genetic factor. Unfortunately, we don't have any hand on it. And the age over 45 put you at risk of diabetes, family history of diabetes, and history of gestational diabetes. So this is, we can say, non-modifiable. We don't have hand on it. But let us to work on the factor that we can modify it and to work on it. And now, hopefully, it will help to reduce the incidence of diabetes in the future. So increase the awareness of physical activity is very important to increase the awareness for the patient to have good body weight, to control their blood pressure, to control their cholesterol. Gestational diabetes, as we mentioned, have 3 types, type 1, type 2, and this is special type, mainly occur during the pregnancy. Women with gestational diabetes are at increased risk of complication with the pregnancy and delivery. And we can say that sometimes patients have diabetes and become pregnant. So those pregnant ladies have high risk to develop complications, especially that congenital heart disease or caudal dysgenesis or high birth weight lead to trauma or birth trauma or hypoglycemia after delivery. These women are these women and possibly their children also are at risk to increase type 2 diabetes in the future. So who is at risk for gestational diabetes? So ladies with BMI above 30 who have previously have child overweight more than 4.5 kilogram at birth, or had gestational diabetes before, or with family history. So according to, and we are following the guidelines and doing screening for those pregnant ladies to do the OGTT on the 24-26 week of gestation. And if she had gestational diabetes before, we have to screen her in the first visit. So who is affected by diabetes? Let us talk about the pre-diabetes. Those people with the pre-diabetes, as mentioned, they have high risk to develop diabetes in the future. So hopefully to increase the awareness about the risk or the dangers from pre-diabetes, we have to control our patient in this stage in order to prevent developing more cases in the future. And also I think anyone can be affected by diabetes. We'll see this statistic that working age adults, older people, adolescents, children, pregnant ladies, we'll see the percentage that most of the affected group are the manpower group from 20 to 64, high risk 72%, and the older people also 27.8, and even was mentioned that even now I'm seeing children and adolescents have also at risk to develop diabetes with the percentage of 0.2%. There are three main focus areas we have to work on it or to know it. Know the risk and how to prevent, how to manage. So know the risk and prevent diabetes. 1 in 2 adults with diabetes remain undiagnosed. The majority have type 2 diabetes. Luckily now, I mean, we have, especially in our medical system, especially for THICA patient, we have this, I think, annually screening test for, they call it WIQAYA. So we discover a lot of cases before they went to more complication. Discovering diabetes early has a big impact on patients' health and well-being, on society and on economy. Treatments. Let us focus on this slide. 98% of diabetes management is self-care. So it is not only the medication have role in control of diabetes, but as we mentioned, the healthy lifestyle and healthy eating, exercise, and to self-monitoring of the blood sugar. But in our practice, we see patients, we can say like 15 to 20% of them, they are non-compliant with the treatment plan. And even those patients who are compliant and taking the medication regularly, unfortunately, they don't want to talk or to discuss these 3 parts, the healthy eating, exercise, and whether they check their blood sugar or not. We offered for them to go to the dietitian to take more information about what the healthy way of eating. But sometimes we find that patient is so reluctant. I hope to work also in the future to increase the awareness of these 3 facts to control the disease beside the medications. Manage diabetes. Managing diabetes properly can prevent or delay so many complications and improve the patient's well-being. To manage diabetes properly, people with diabetes are required to eat healthy, be active, monitor blood sugar, and to take the medication. So taking medication is not enough. We have to work on all these facts. Get education on the problem solving, reduce risk of getting complication, and to cope with the diabetes. Some people, you know, when we diagnose them with diabetes, they spend long time to accept the fact that he have diabetes. We keep wasting time, I can say, and repeat labs here and there. Just he don't want to know that or to convince that he have diabetes and he have to start on a treatment. Diabetes education by the diabetic educator and the dietitian, as we mentioned, is very important. Blood sugar control. People with type 1 diabetes require insulin. In fact, in type 1 diabetes, there is a lot of development in this part, especially now we have the modern insulin, we have the continuous glucose monitoring, the insulin pump, and the artificial pancreas. So despite that type 1 diabetes is very difficult, but at least we have the new technology to control it. And people with type 2 diabetes can be treated with oral medications, but may also require insulin. And even with the type 2 diabetes, there is a lot of development in last 10 years. We have the new treatment for diabetes. proven with the proven cardiovascular benefits like SGL2 or GLP-1 to add it to the treatment of type 2 diabetes. As we mentioned, it's not diabetes not only matter to control the blood sugar, but we have to take the what you call the patient-centered approach. We have to control all the other medical problems to control his diabetes and to control blood pressure, to control the cholesterol, and to keep searching and investigating for other hidden problems, like the complications. We have to screen the eye for retinopathy, for the kidney disease, for peripheral vascular disease. So it does not only matter to control the blood sugar, we have to control all the other facts. So also we have to food care in our practice. We are frequently examine the feed for any signs of infection or diabetic food or reduced sensation, and we advise them to take care about their feet. So patient self-care by maintaining food hygiene, wearing appropriate footwear, seeking a professional care for ulcer management, and regular examination of the feet by health professional. Early screening and the treatment for the complication. We will talk about it. So why we have to take care? Why diabetes matters? Diabetes have impact on the individual, social, and economy. Definitely, when you diagnose a patient with diabetes, definitely has an impact on the patient himself. But definitely, this will expand even to his family and to the social impact, and also impact on the economy. I think the insurance company, they know the cost of a treatment of one diabetic patient per year. I have no idea, but maybe I can say maybe $10,000. I don't know about the cost. So has a major health impact on individuals, as we say, over the time, and if not controlled, diabetes can damage any organs, heart, blood vessels, eyes, kidney, and nerves. So in our, with our patient, we are regularly examine them for any signs of retinopathy. So we have they call it the retinal image every year, and if there is any signs of retinal damage, we send them to ophthalmologist. For the kidney, as we are repeating the blood test every 3 months to see the creatinine, but also we are doing the albumin creatinine ratio to catch if there is any decline in the kidney functions, and we send them to the take opinion from the nephrologist and to put them on the medication to protect the kidney. And for the diabetic neuropathy, as we mentioned, we ask them about the signs and about the symptoms of any neuropathic pain, and we examine the feet for any signs of reducing sensation and if there is any signs of peripheral vascular disease to prevent the complication in the future. For hearts, definitely it's one of the important organs that can get damaged by diabetes in form of heart failure with the preserved ejection fraction, and also diabetes, as I mentioned before we consider diabetes as a risk for cardiovascular disease. In fact, it is equal to cardiovascular disease, and also the diabetes increases the risk of stroke. So 1 in 6 live births are affected by high blood sugar during the pregnancy, and this likely due to gestational diabetes. High retinal disease due to diabetes is an important cause of blindness. As we mentioned, that we are regularly investigating our patients and by retinal exam to see if they have any early signs of diabetes retinopathy. And diabetes is the leading cause of blindness and visual disability. Sometimes, in our practice, when we discuss the diabetes with our patients, we also sometimes highlights on the complication. Even if the patient currently he doesn't have any complication now, but we keep remind them about if they keep not following the treatment plan, non-compliant with the treatments, not compliant with the healthy lifestyle, they might have serious complications in the future. Tell them that it causes blindness, renal disease, or end up with dialysis or amputation. This is a very good way in order to motivate our patient to become more compliant. about 60 to 70% of people with diabetes have mild to severe form of nervous system damage. So regularly in our clinic, we keep ask the patient if there is any symptoms of a neuropathic pain and or others. They call it autonomic neuropathy. We ask them, especially in male, we ask about if there is any symptoms of, erectile dysfunction. Also, it is a sign of diabetes. One of the complications. More than 60% of non-traumatic lower limb amputation occurs in people with diabetes, and an amputation occurs every 30 seconds due to diabetes. Patients with diabetes have 2 to 3-fold increased risk of heart attack and stroke. This is what we are seeing before when working in the hospitals. Many patients, they admitted with heart attack, MI, or stroke, and then we discover they have diabetes. I think there was a study before in Ain Hospital in 2000, maybe 10 or 2008. We discovered that 30% from the admission to the intensive care and stroke unit, they have diabetes and they don't know about it. Kidney problems occur in 20 to 40 of patients with diabetes and is among the leading cause of the kidney failure. In fact, in the last 2 years, especially during the COVID, when there is lockdown, as you can see, 3 of my patients, unfortunately, there was difficult to follow up, and they already non-compliant with the treatment plan, and their hemoglobin A1C more than 10. Unfortunately, they end up with end-stage renal failure, and now they are on dialysis. Diabetes is among the top 10 cause of death. Diabetes increases the risk of early death. Do you have diabetes? It reduces the risk of, or reduce the life expectancy by 6 years. And if you have diabetes with cardiovascular disease, it cuts down your life expectancy by 12 years. It's a scary number. International Diabetes Federation announced that approximately 6.7 million adults died as a result of diabetes and its complication in 2021. Mental health. Diabetes increases the risk of depression. It's one of the important also area to concentrate on it in the clinic. We ask the patient about anxiety, depression, and diabetes also increases the risk of Alzheimer in the future. So depression is 2 to 3 times more common among people with diabetes compared to those without diabetes, without the disease. Depression is risk increase as a complication developed. We search them a special questionnaire if they have any symptoms of depression. Also, we send them to our psychiatrist to deal with this problem. Social impact. As we mentioned before, the diabetes have impact on patient himself and on the level of the social. Management requires strict adherence to a self-care regimen, which often challenges people with diabetes and those who care for them. The family also is affected. If you have one member, if you have one member from your family have diabetes, all the impact is not on the patient himself, definitely on his family also, and it affects interpersonal relationship. Economy, as I mentioned before, diabetes is an expensive disease, and definitely insurance, they have more, they can help us in this part. Diabetes also imposes a significant economic impact on countries' health system, and when healthcare must be funded out of the pocket on people with diabetes and their families. Diabetes was responsible for at least 967 billion in health expenditure in 2021. It's expected to be more in the future, unfortunately. Definitely very expensive disease, especially if it ends up with complications. Prevention, this is very important topic. You can prevent or delay the type 2 diabetes by following these steps: watching and maintaining a normal health weight, eating a balanced, healthy diet, staying physically active, control your blood pressure and cholesterol, stop smoking. If you are at risk, you need to visit a doctor to check your medical history, perform physical examination, and ask for laboratory tests. Luckily, in this our country here in UAE, we have, especially for locals and even for non-locals, it's easy for them to do the lab test and to discover to discover if they have high blood sugar or cholesterol. We discover, diagnose many cases just at the level of the lab before they have the full-blown picture of their disease. Thank you.
Thank you,
I hope
Dr.
that. Thank you.
Yes, go ahead, please.
Maybe it was very fast, the presentation, but I try to focus on some areas of. Thank you. If there is any question, I'll be more than happy to receive.
Yes, thank you, Dr. Ahmed, for such an informative presentation around one of the most common health conditions, especially here in UAE. So now we will be moving on to the Q&A section. So first question, Doctor. Will the HbA1c test result be accurate for people who have blood issues?
No, for hemoglobin A1c, there is a lot of false low, false negative, or false low, or false high. We have to consider all these things, like special patient with renal failure or iron deficiency anemia or hemoglobinopathies. Sometimes we need another we can say another lab. They call it the fructosamine to diagnose the diabetes. But in those people, we are not using the fructosamine too much. We depend on the self or the daily readings of their blood sugar, as I mentioned. So the hemoglobin A1c sometimes not reflect the accurate level due to these problems.
And what should be the frequency for diabetic patient to go for screening of retinopathy, nephropathy, and neuropathy in a single year?
So it depends. Definitely it's every year. Okay, but if you find any retinal damage, definitely have, especially if it's in first stage, you can keep with them, but definitely you have to send them to the ophthalmologist, but you keep screening them every year. But if there is damage, so the ophthalmologist will take care about. And for the kidney, there is no, deterioration, renal function, and the albumin creatinine ratio is normal, so every year. But if there is drop, especially if they drop, the sudden decline in the GFR, the glomerular filtration rate, or the renal function, especially if suddenly drop, sometimes we have to think about the other cause rather than diabetes. It's happened many times. So patient may have another renal disease, and we keep just follow up. And so in sudden decline, we have to definitely send them to a nephrologist. For neuropathy, this is what we are doing annually. But if there is patient with symptoms, definitely have to go for the neurologist to start treatment to control.
And doctor, in case of traveling, how can I preserve insulin?
So definitely we pharmacists in our pharmacists, they are doing very good job and explain to the patient how to take care about it. I think there is a special bag with the ice, and also you have to take the prescription with you on the airport, to show them. And I think also inform the airplane crew about it. I think they have, they keep the insulin special fridge in the airplane.
Great. And doctor, certain injections decrease my appetite and I am afraid of hypoglycemia. What shall I do in this case?
Actually, this is a new medicine. As I mentioned before, the type 2 diabetes, they are lucky because we have now new treatment to control the weight, to control to reduce the cardiovascular problems in the future and to protect the kidney. The GLP-1, many types of injection we have, like now I think the Mounjaro, tirzepatide is one of them, semaglutide, Trulicity. So all these medications which are used now in type 2 diabetes, but also it can be used for treatment of obesity. The risk of hypoglycemia, very low. So no need to worry about it. But definitely there is, with side effects suspected, like nausea, vomiting, headache, some other GIT symptoms like, constipation, diarrhea is expected. But the risk of hypoglycemia is very low. And that is the beauty of this medicine. We are using now more than insulin. Before starting insulin, especially with patients with type 2 and high body mass index, obese, better to start with this medicine it might help to reduce the weight, to reduce the hemoglobin A1c, and to reduce the complication, and may delay also the starting our patient on insulin. So the risk is very low with hypoglycemia.
Great. And doctor, is high sugar levels related to infections and repeated ulcers in the mouth and the tongue?
One of the any stress or any infection lead to disturb the blood sugar control. So, I mean, in this transient period of the infection, we expected that the blood sugar will go high. We reassure our patient, but if the problem is persist, like a chronic infection, if you have diabetic foot, if you cannot control it, definitely the blood sugar will go up. So maybe we need to modify our plan to start on insulin if we have chronic problems, chronic infection, I mean, like osteomyelitis and diabetic foot.
And is it possible to reserve type 2 diabetes or be cured completely of diabetes?
Cure is one of the hot topics they are discussing many times in the conferences. Now we get an example: patient with diabetes, obese, and they went for bariatric surgery. They are losing more than 40% of their weight. They get out from the diabetes, but is it cure? This is the I mean, this is the medical term. We can use it or not, but they can say it is in remission. We cannot say it is in cure, but from our experience, and now, especially in this part of the world, we have a lot of bariatric surgery in the last 10 years. So it's good results. Now just we following the patients, and they stop all the treatment for the diabetes, for the cholesterol, for the hypertension. It's good results. But cure, still there is, can say debate about this term, whether cure or not, but they like to use remission.
Great. And Great. And someone is inquiring, if you have been taking metformin medicine for diabetes for 15 years, and after that, does our body have any negative impact because of the metformin?
No, I see. Then just go to the history. I think metformin is launched or starting to use it as for diabetes in early 50s. Now, more than 8 years. I think, metformin is one of the I think there is a study also about the metformin. It reduces cardiovascular morbidity and mortality in patient with diabetes. It is important also to control the weight. And does it have any negative impact? It's a great medicine, in fact. Yeah. And there is some studies also. I saw it before. They combine the metformin with the treatment of cancer patient. They found also it is, but this is small study. I cannot depend on it. But I mean, even it reduces cancer. I cannot say that, but there is a study to combine metformin with the treatment lines of cancer patients, some kind of cancer. I cannot remember exactly the study, but definitely it is very safe medicine. Otherwise, it will be, if you follow, if you go to the history again, that I mentioned now, metformin now in the management line. The top one, all the they changing the guidelines, but the metformin is the first one with the lifestyle modification. Some treatments, and especially in the last 15 years, we have one of the thiazolidones, one of the treatment of diabetes, showed that increase the risk of heart disease. So it's withdrawn from the market, I think in 2008 or 2010. Yeah. So despite all this time, metformin is still the first option and the first line of treatment.
And doctor, can a child go from type 1 to type 2 diabetes?
Type 1, no. And type 1, as you mentioned, it's autoimmune disease. There is antibodies attack the beta cells. But what we found now, because the insulin is increasing weight, right? And unhealthy lifestyle also increase in weight. So what we are seeing nowadays in the clinic, type 1 usually when patient presented to the clinic is slim, but after long time, because of the insulin and healthy lifestyle, they become obese. So what they call it, they use it another term, they call it double diabetes. So they have, when increasing in weight, it increases insulin resistance. So now I think metformin, as you asked before, now we are using metformin in type 1 if the body mass index more than 30. Also it is safe, but we have to keep eye on the patient if there is mild risk to develop lactic acidosis. But I mean, but to become type 2, no. But I mean, increase the weight and need to insulin resistant.
Great. And doctor, in Ramadan, when fasting, when should we exercise? Before or after iftar?
I think after better, because then the same patient before iftar, and it's very difficult for our body to come to adapt the fasting, and they are doing exercise before iftar. I think it is put them at risk, especially for the diabetic patient to develop hypoglycemia. I think after Salat al-Tarawih, it would be a good time.
Great. And how is blood pressure related to diabetes?
So it's one of the risk factors, as we saw in the slide, increase the risk. But also, I mean, as I mentioned, when to take the patient diabetes, we follow the patient-centered approach and to control all the medical problems, not only to control his blood sugar as before we were, 20 years before, we just look at the blood sugar and we were happy if we keep the hemoglobin A1C in the normal range. I mean, I don't want to say that we don't want to take care about the blood pressure and the cholesterol, but now it is very important to control all the factors to reduce the complications in the future. So definitely, if the blood pressure is high, we have to control it. If the patient have albumin-creatinine ratio or renal damage, we have to put the blood pressure to lower limits. To 125/75, which is acceptable if the patient have renal damage.
And doctor, moving on to diet, what herbal and food helps naturally reduce high blood glucose in the body?
So as far as I know, I think dietitians have maybe she can answer these questions better than me. But I know that the cinnamon is one of the important. There is a study about it. It showed that reduce the blood sugar, I think, by 7 to 10 milligram. The other one is, they call it the bitter gourd. I think especially if you go to the Spanish and Lulu, them in the Indian, they like it. There is a study about it. It helped to reduce the blood sugar. And in general, it's not only these two kinds. There is the healthy eating to increase the fresh vegetables, fruits, fibers, exercise. All this help to reduce the diabetes.
And for pregnant ladies, will they still have gestation diabetes after giving birth?
No, we have to stop them indefinitely. If they are diabetic, no, you have to continue treatment. But gestational diabetes, they have to stop the treatment immediately at birth. And after 3 months, we have to check their blood sugar. Some cases, unfortunately, they will have diabetes, and gestational diabetes increase the risk to have type 2 diabetes, I think by 50% in next 3 years. So we keep follow up them every year to do the hemoglobin A1C and fasting blood sugar. But definitely they have to come to the clinic after 3 months to check their blood sugar.
And if we have a proper control of blood sugar, can we stop using insulin and move on to only drugs or oral therapy?
Definitely. This scenario has happened many times in the clinic. Patient, they came with high blood sugar. We put them on insulin like for 3 to 6 months, and then especially, as I mentioned, with the new medicine, especially if they are obese, we put them on GLP-1 later, SGL2, and reducing their weight and the blood sugar control. So we cut down the insulin. This is one of the challenges in the clinic. When you want to start the insulin to the patient, he's afraid. He feel like that it is like the end of the disease. It is not the end of the disease. It's one of the line of the treatment that we can stop it in the future. We can modify it like this.
And someone, doctor, also is inquiring, if my A1C was 10% and it was my first time checking it, will I be on insulin immediately?
Well, if you go to the guidelines, the hemoglobin A1C more than 8.5 and more than 9 should be on insulin, especially if you have, as I mentioned, the symptoms, the osmotic symptom, patient came with weight loss, thirst, excessive polyuria, definitely have to be on insulin in this stage. Then we will see after 3 or 6 months, maybe we can change or reduce the dose of insulin, but definitely have to be on insulin in this. Some of patients, they are refused. So in this case, but definitely with osmotic symptom, you have to be on insulin. But without osmotic symptoms, a patient refuse, total refusal insulin, definitely we have to start on another lines of treatment.
And doctor, in case of hypoglycemia, so what to do if someone fainted because of low blood sugar levels?
So this one, and in our practice, we keep asking the patients about any hypoglycemic event happened in the last 3 months, and most of our patients, they had some attacks before, so they know how to deal with it. But the most important also to teach the patient and to teach their family how to deal with it, especially. And so we tell them that if you check your blood sugar, especially during Ramadan time, we increase the education to our patient during this. So if you find the blood sugar is less than 70 and you are fasting, better to stop fasting and to take simple carbohydrate like juice or honey or anything, just to keep your blood sugar on the limit. And definitely if it's less than 55, some of patients, they don't want to stop their fasting if it's less than 70, but definitely it's less than 55, they have to stop and to take something to increase the blood sugar.
And doctor, so in reverse, someone who has hyperglycemia, but they complain that they don't eat much and their blood sugar levels are high, always high. So why is that?
So this is what we're telling them, to develop diabetes is a long story. If you go back to the slide and we'll see the pre-diabetes and this stage, patient, because of the insulin resistance and high body weight, insulin resistance, so there is exhaustion of the beta cells. So there is no insulin for them. They have to be on insulin. So this keep asking, doctor, I'm following the healthy diet and exercise and my blood sugar is still uncontrolled, hemoglobin A1C. So that's mean beta cell failure. You have to be on insulin, unfortunately.
And doctor, while presenting, you mentioned something about SGL2 treatment. So what's this treatment?
Treatment, as I mentioned, patients, especially type 2, they are lucky because this SGL2 found that improve they call it the 3 MACE, the major adverse cardiovascular event, reduce the non-fatal stroke and non-fatal MI, cardiovascular mortality, and there is good studies about the kidney protection on both sides. Empagliflozin, dapagliflozin, it showed that reduce the decline in the GFR and protect the kidney. Now there is some debate why for type 1, also they are at risk to develop kidney disease and cardiovascular, right? But we cannot use it because it is increased the risk of diabetic ketoacidosis. So it is very important if you go now to the guidelines, the new guidelines, ADA guidelines, as I mentioned, healthy lifestyle, metformin, and you have to look at your patient. If you have cardiovascular disease, better to be on GLP-1 or SGL2. If the patient have heart failure, the second line should be SGL2. If the patient have cardiovascular disease, should be on GLP-1. If the patient have kidney disease or heart failure also, it should be on SGL2. So it's very good medicine on those patients. Even patients if they don't have this, kidney disease or heart failure or GLP-1, there is evidence also from the DECLARE study for the dapagliflozin, which showed that it helps also to reduce cardiovascular problems, and also is important to reduce heart failure hospitalization. So now they license this medicine from the cardiology side to use it for patients non-diabetic, or to control their heart failure symptoms, and also for kidney failure. They are not diabetic. There is evidence from DABA CKD study. They use it for other cause of kidney disease.
And doctor, when going to the dentist, why they always ask someone with diabetes if their A1C is controlled or not?
Yeah, because this is surgery. So I'll tell you the scenario. Patient, referred from the surgical clinic for fitness, whether he fit for any surgery. The hemoglobin A1C should be controlled less than 8.5 or less than 8 to be ready for the surgery, to reduce the risk of complications after surgery, like infection, poor wound healing, all these things. For the mouth surgery, because especially in the mouth surgery, we need to very good control for the blood sugar, especially when we receive the consultation from the dentist for dental implant. So it's very important to reduce the complication or failure of implant in the future. So we need less than this. Better to be less than 7.
And doctor, why is it advisable to take the flu vaccine for diabetic people?
For everyone, not for diabetic patients. But also, I mean, the other, I think in our practice also in here, for hepatitis B vaccines and other vaccines, especially hepatitis B vaccine is important for diabetic patients. If they end up with renal disease and they go for dialysis, this is very important to protect them from getting hepatitis B. But I mean, in general, you know, diabetic patients have low immunity, so better to protect them with hepatitis B vaccines and flu vaccine.
So, doctor, now for our last question for the day, how can diabetes impact person's emotional health?
In a clinic, we'll try to see if there is any symptoms of depression or not. Some patients, they difficult to, unless we starting as a healthcare professional, we start asking them some questions to see if they have depression. Anyone with any chronic disease, not only diabetes, you may end up with depression. It's very important, as I mentioned before, it's not only to control the blood sugar. You have to take the patient from, I mean, full package from A to Z. So the mental health is very important to concentrate on it.
So this was our last question for the day, doctor. Thank you, Dr. Ahmed, for such an informative presentation around one of the common health conditions here in the UAE. Thank you for your input and your valuable information.
I have a question for you. For the insurance, so I'm talking about the pre-diabetes and obesity. As I mentioned before, if we control the patient in this stage in pre-diabetes and obesity, will reduce the incidence of new cases of diabetes in the future. So from insurance, is there any plan in the future to license some or to get approval for some medicine in this stage? I'm talking about the obesity medication. For difficult question.
Yes, it's a difficult question. Yes, for now we have like what do we call it, like campaigns and so on to prevent or to educate people more about the adverse effects of diabetes for
Definitely.
now. Yeah. Yes. Thank you, doctor. Yes, thank you, doctor, for your valuable input today. And dear audience, this is the end of our webinar. Please take a moment to answer the survey questions. Your feedback and input are appreciated. Moreover, note that you can view the replay of the current webinar as well as the previous webinars in our YouTube channel, Daman Insurance. Thank you for joining us today, and special thanks to Dr. Ahmed for your valuable input. Looking forward for meeting you at forthcoming webinars. Stay safe and enjoy the rest of the day.
Thank you.